Hi, everyone. This is Inga Lennis. I am the Senior Vice President of Practice Improvement and Patient Experience at the MGPO at Massachusetts General Hospital. And I am really pleased today to be with Dr. Erica Shenoy, who is our Associate Chief of Infection Control. And before we get started, I just wanted to thank Dr. Shenoy, who has been keeping us safe throughout the last 7 months. And so with all of the work that the Infection Control Group is doing, for the employees and the patients at Massachusetts General Hospital. So today we are going to talk about CORAL. Before I start, I'm just going to ask Dr. Shenoy to tell us a little bit about what that acronym is for and what it means and how it started.
Yeah, so thanks for having me and thanks for everything that everyone's doing out there. So I'm really excited to talk about CORAL. So CORAL stands for COVID Risk Calculator, and I got that out of a acronym generator when we were developing this during the surge, and really that's how it came out. And then I have to thank one of our pediatric ID colleagues who came up with NEMO, the child of CORAL, for the pediatric version of CORAL. But essentially what this is, it's a risk calculator tool that was developed by the Infection Control Unit here, the Division of Infectious Diseases, and we collaborated with eCare to basically take the epidemiology, the symptoms that a patient would present with, and some other diagnostics to help you work them up in someone who might have COVID. And those people get the COVID risk infection status. And it really is not just about trying to resolve the risk, which it can do. It's about guiding you through the workup. And it's been in place at MGH on the ED and inpatient side since May 20th. And it has been, I think, widely accepted, really pretty much. We had a 1-week wash-in period, but it has really been used very easily, I think, on the ED and inpatient side. And we've made improvements over time to make it as streamlined as possible for the frontline clinician to do.
Great. Can you tell me more about how we use, what's the use of CORAL in the outpatient setting?
Okay, so there's two primary uses. Let's say you have a patient who developed some symptoms that were consistent with COVID. You sent them to get a COVID test and they have a negative test back. They have that COVID risk infection status on their record. And if you at that point think, I think I'm done the workup or I need some more help, what you do is you start an encounter. We recommend use a documentation encounter. You can also use orders or visit or telemedicine, but if you use the last one, the visit or telemedicine encounter, it can convert the encounter to a visit. So if the patient doesn't show, it can be problematic. So I would say start a documentation encounter, and then you just go to the progress note and you type .coral. You can type .NEMO if you're a pediatrician, but it doesn't even matter because Epic knows what the age of the patient is and it's going to apply the right one anyway. So what it does is it comes up with a couple buttons that you have to click within your note, and it's documenting what you know to be true. Have their symptoms resolved? It knows that you have a negative test. It will look at some other things that might be in the record, and it's going to present you with either you're done with the workup, and when you sign that note, magically the infection status will disappear and you don't even have to call infection control or do anything. Now, if it says, we don't think you're done this workup, it will give you the next step, which may be getting another test or a referral to a place like the RICS that could evaluate your patient. So it's going to give you some decision support there. May also route this note to infection control where we can give you some additional advice. But I think for the vast majority of outpatients, it's going to allow you to resolve it at the time that you sign your note.
Oh, that's great. So this allows us to resolve the COVID status so that we don't have to wonder when we're trying to triage patients in ambulatory. Because
Exactly.
If they couldn't resolve the COVID status, then they would need to get their ambulatory care in the RAC. Is that correct?
Exactly. And so that's the COVID risk part. And I can tell you the second thing it does if you want to hear about the other infection statuses. Okay,
Yes.
So previously for COVID-19 and COVID presumed, so these are patients who have a diagnosis of COVID or we think they have COVID, those will resolve over time. However, if you have a patient who has a visit coming up and they meet the criteria for resolution, Previously, you had a very long dot phrase. It was not as beautiful as it's going to be now, but if you type .coral for those patients, it's going to give you a similar little push buttons, and then it will route it to infection control. Those ones we don't do automatically because we want to take a look at that record and make sure everything is perfect, but it will do that as well. So .coral will be your one-stop shop for those. I do want to emphasize, people try to resolve COVID exposed. You can't resolve COVID exposed because COVID exposed is 14 days, no matter, they could have 10 negative tests. I mean, that would be excessive, but we can't resolve COVID exposed before the 14 days are up. So the other infection statuses we're using .coral for right now.
Great. Oh, that is so helpful. So, and are doctors or APPs the only people that can do coral, or is it available to nursing as well?
It's available to nursing, and this is in the ambulatory side. So all the ambulatory clinicians, nursing, MD, DO, there's a whole, they're all able to do this. And again, it's pretty simple once you've done it once. And we already noticed when we went live last week that we had a dramatic decrease in requests in our in-basket to review COVID risk. And I think it's because people are adopting this.
That's great. Well, thank you again for all of this great information, and thank you to the creators of Coral, the systems that allow us to do this quickly and for ourselves. And thank you to the infectious disease and infection control team members who've been reviewing this all along for us over the last month. So I'm glad that we've had that relief for all of you. Thank you for joining us for this Two Things.
Thanks for having me.